Hey YouTubers, it's Dr. Alessandro. Welcome back to my channel. Please like and subscribe. And in this video, I'm going to be going over what exactly constitutes a dental emergency. As many of you know, because of COVID, a lot of offices around the country, depending on what state they're in, are closed for your regular and routine visits. So your checkups and cleanings, your small fillings, things that you would just do ordinarily can't be done. But a lot of offices are open to see emergencies. So what constitutes a true dental emergency? This is really important because some offices will see certain emergencies only if you have a lot of pain. Some actually at this point won't see any emergencies at all, depending on which office it is and who owns the office. So it is a little bit varied across the country. I can't give you an exact formula for who will see what, but here are the things that dentists, according to the American Dental Association guidelines released back in March, can see, and states have largely adopted this and followed this guideline. So trauma. So if you get hit in the face with something and your teeth are broken or knocked out, things like that, yeah, that is absolutely an emergency. I do encourage you to go to your dental office or a dental office to seek care, because that's really important to seek as quick a care as you can. So immediately, of course. Now, one caveat, if for whatever reason you get hit in the head and you're knocked out, go to the hospital first, because that can involve brain injury or things like that that is more severe. And a hospital should rule anything out before you go to a dentist to have the teeth checked. So if you get knocked out, knocked unconscious, go to the hospital first, to the ER. Otherwise, come to see us first. Now, if you have infection or swelling, so you have a tooth that's hurting you and all of a sudden your face gets swollen, please come see a dentist right away. Okay, right away, please come see a dentist. We can certainly help you and we'd love to help you. So please do that first. Because we are probably a safer place to go than the hospitals in a case like that. So come see us first. We'll try to manage it to the best of our ability first. So yeah, stay away from the hospital as best you can. Pain, like a dental pain. You had a really deep filling done a while ago. Now it's starting to hurt a lot. It's keeping you up at night. Maybe you can't chew on it. There are issues like that. Come see a dentist. That's really important that you do. Wisdom teeth. If wisdom teeth are bothering you, absolutely see a dentist, see an oral surgeon, somebody, because again, those can become infections that can become severe pretty quickly. And the last thing you want to do is end up in a hospital because of that. That's going to maybe put you at risk for exposure to COVID, and it's going to give you a big hospital bill. So let's keep you out of there and in dentist hands, because we can usually manage things on our own and do a little bit better than a hospital for a dental emergency. If you have a deep cavity, or you've known that you've had a deep cavity, say you had a checkup right before everything closed down and they said, hey, you have a deep cavity, you should get it taken care of pretty quick. Again, get it taken care of. So if, say, and I've had an emergency patient, I got a big hole in my tooth, that constitutes an emergency. It may or may not be hurting you, but if it's more than halfway towards the nerve of the tooth, that can become a really big problem quickly if it's not taken care of. And so, again, something that's a big hole in the tooth, the more than halfway towards the nerve or getting close to the nerve, it's starting to hurt you. Yeah, we need to see that. We need to get you in. Anything big, we need to get you in. If it's a small cavity, that can wait. You stay at home, that can wait. Denture adjustments, if you can't chew with your dentures. Yes, by all means, please, please, please come in. We can adjust that. Or if there's a sharp edge that's cutting into your tissue, that should be adjusted. That's important because, again, you're creating sores in your mouth. Those can get infected. And, again, that can create problems down the road. Same thing if you have braces and you have a wire that's cutting into your gum or into your cheek somewhere. By all means, we should see that. We should adjust it. And that way you can have relief and it doesn't cut into your tissue and possibly create infections. Crowns. Now, if you had, before everything started, if you had a crown preparation done and you have a temporary crown, if that temporary crown is starting to get beat up, and after about a month it probably is, then that can be removed and the permanent crown can be cemented. So if you're having damage to that temporary crown, or if the temporary crown has come off, or the temporary crown is cutting into your gums, again, kind of creating wounds in your mouth. Okay, time for that temporary crown to be removed and either replaced with a new temporary or with the crown that you're originally supposed to get. That is still an emergency, and that's okay. We're not allowed to make new crowns necessarily, but we can manage those sorts of situations. And then say you had a checkup done and a dentist saw an area of soft tissue that didn't look quite right. It is okay for a biopsy to be done according to the American Dental Association guidelines. It's okay if a biopsy is done for abnormal tissue because otherwise you could be delaying potentially treatment of cancer. And we definitely don't want to delay any kind of cancer treatment because any kind of delay in that could really cause you problems down the road, and we definitely don't want that. So biopsy of abnormal tissue is an acceptable treatment because we need to treat cancer as quickly as possible. So if it is cancer, we want to get on that very, very soon. So there you are. That's kind of an idea or a basic guideline of things that you should be going to your dentist for in this time that do constitute emergency or urgent treatment. Again, like I said, your small fillings, your checkups, your cleanings, that sort of thing, or consults for big treatment down the road when everything is otherwise stable, that can wait. And it should wait until everything is really as stable as it can be and okay to open back up to your routine treatment. So thank you again for joining me on this channel. Please like and subscribe, and hope you're all staying well and healthy in these times.